Picture this: 1 in every 5 adults experiences anxiety disorders each year. That's about 40 million people in the US alone. Can you imagine that? Globally, it's an issue that touches countless lives, affecting everything from everyday tasks to overall health. The prevalence of anxiety disorders is not just startling, it's a clarion call for attention and understanding. Remember, these disorders are not figments of the imagination. They are as real as any physical ailment. Anxiety disorders are real, serious, and widespread. So what exactly is an anxiety disorder? Let's hear from some experts. Anxiety disorders are a group of mental health conditions that trigger excessive and persistent fear, worry, or nervousness. They are more than the occasional anxious feelings we all experience. They can be debilitating, interfering with daily life, and can last for 6 months or more if not treated. Mental health professionals categorize anxiety disorders into several types, each with its own unique symptoms and triggers. The most common types include generalized anxiety disorder, characterized by chronic excessive worry about various aspects of life; panic disorder, marked by recurrent panic attacks that happen unexpectedly; and social anxiety disorder, which involves intense fear of social or performance situations. Then we have phobias, irrational fears of specific things or situations; and obsessive-compulsive disorder, a condition characterized by unwanted repetitive thoughts and behaviors. Lastly, there's post-traumatic stress disorder, which develops after experiencing or witnessing a traumatic event. Each of these disorders is unique, but they all share a common thread. They can significantly disrupt a person's life. A person with an anxiety disorder might struggle with simple tasks like grocery shopping or driving. They may avoid social situations for fear of experiencing symptoms, leading to feelings of isolation. Their sleep may be disrupted, or they might find it hard to concentrate. In severe cases, an anxiety disorder might even lead to physical health problems, like heart disease or gastrointestinal issues. It's important to remember that anxiety disorders are not due to a lack of willpower or personal weakness. They are real, serious medical conditions, just like heart disease or diabetes. And just like these physical health conditions, anxiety disorders can be managed with the right treatment and support. But how do these disorders come about? What causes them? And most importantly, how can they be recognized and treated? These are the questions we'll be exploring in the next sections. As we can see, anxiety disorders are more than just feeling nervous or worried. But what causes these disorders? Are some people just more prone to anxiety than others? These are questions that many of us have asked, and the answer is not as straightforward as you might think. Anxiety disorders can be caused by a myriad of factors, and often, it's a combination of these elements that lead to the development of an anxiety disorder. Firstly, let's talk about genetic factors. Just as you might inherit your mother's eyes or your father's laugh, you might also inherit a predisposition to anxiety. Research has shown that individuals with family members who have anxiety disorders are more likely to develop one themselves. That being said, having a family history of anxiety doesn't guarantee you'll experience it. Another significant cause is brain chemistry. Our brains are complex networks of chemicals and neurons, constantly communicating and reacting to our environment. When these chemical balances are disrupted, it can lead to symptoms of anxiety. For instance, an imbalance in neurotransmitters such as serotonin and dopamine, which are involved in regulating mood, can contribute to anxiety disorders. Personality also plays a role. People with certain personality types are more prone to anxiety disorders. For example, those who are perfectionists, easily flustered, or have a low self-esteem can be more susceptible to anxiety. Life events, particularly stressful or traumatic ones, can also trigger anxiety disorders. Experiencing or witnessing a traumatic event, enduring chronic medical illnesses, or even going through a significant life change like a job loss or a divorce, can pave the way for anxiety to take hold. However, it's crucial to understand that these factors alone do not cause anxiety disorders. Rather, it's often a combination of these factors, along with other unknown variables, that lead to the development of an anxiety disorder. So, while one person may have a genetic predisposition and experience a traumatic event, they may never develop an anxiety disorder. Meanwhile, another person without a genetic predisposition may develop one after experiencing a similar event. While there's no single cause for anxiety disorders, a combination of factors can increase a person's risk. Remember, understanding these causes is the first step towards managing anxiety disorders and promoting mental wellness. Opening. How can you tell if you or someone you know is dealing with an anxiety disorder? Well, recognizing the symptoms is an essential step in identifying anxiety disorders. However, it's important to remember that these symptoms can vary widely from person to person. What one individual experiences may be entirely different from what another person goes through. Anxiety disorders can manifest physically, cognitively, and emotionally. Physically, you might notice symptoms like a racing heart, rapid breathing, or excessive sweating. Some people may feel a tightness in their chest or a churning sensation in their stomach. These physical signs are often the body's response to perceived danger or stress and are part of our natural fight or flight response. Cognitive symptoms are those related to thought processes. These might include persistent worrying, racing thoughts, or a sense of impending doom. Individuals with anxiety disorders often find it difficult to concentrate, as their mind is constantly filled with worries and fears. They may also struggle with negative thinking, always expecting the worst to happen. Emotionally, anxiety disorders can lead to feelings of restlessness, irritability, or a sense of being on edge. Some people may feel constantly tense or nervous, while others may experience bouts of panic or fear. It's important to note that everyone experiences anxiety at some point. It's a normal reaction to stressful situations. However, when these symptoms become chronic, intense, and interfere with daily life, it might be an anxiety disorder. Also, remember that these symptoms can also be associated with other medical conditions, so it's always a good idea to seek a professional opinion. And while it can be challenging to reach out, it's a vital step towards understanding and managing your mental health. In summary, recognizing the symptoms of anxiety requires a keen understanding of your body and mind. It involves noticing changes in your thoughts, feelings, and physical sensations, and acknowledging when these changes are causing distress or interfering with your daily life. Closing. Understanding these symptoms can be the first step towards getting help. The journey to mental wellness often begins with recognition, so don't be afraid to take that first step. Living with an anxiety disorder can be challenging, but there are strategies that can help. When anxiety disorders take the driver's seat, it can feel like you're just along for a wild and unpredictable ride. However, there's good news. You can take back the wheel. There are numerous coping strategies available, and today, we'll delve into a few of them. Therapy is one of the most effective strategies for managing anxiety disorders. Cognitive behavioral therapy, or CBT, is a commonly used approach that helps individuals understand and change thought patterns that lead to harmful behaviors or feelings of anxiety. It's like having a personal trainer for your mind, helping you overcome mental obstacles and build resilience. In some cases, medication can be a useful tool. It's not about numbing feelings or creating an artificial sense of calm, but rather, it's about restoring a natural balance of chemicals in the brain, making it easier for you to engage with other coping strategies. Remember, medication should always be prescribed and monitored by a healthcare professional, and it's usually most effective when combined with other therapies. Then, there are lifestyle changes. Think of your body as a finely tuned machine. If one part is out of sync, the whole system can be affected. Regular exercise, a balanced diet, and good sleep hygiene can all contribute to better overall mental health and help manage the symptoms of anxiety disorders. These may sound like simple steps, but their impact can be profound. Mindfulness and meditation practices can also be powerful allies in the battle against anxiety. These techniques help you stay present and grounded, reducing the impact of anxious thoughts. Like learning a new instrument, it takes practice. But over time, you'll find yourself becoming more proficient in tuning out the noise and tuning into the now. Lastly, but by no means least, self-care practices are essential. This isn't just about bubble baths and spa days, although those can certainly be part of it. Real self-care is about taking time out for yourself, setting boundaries, and saying no when you need to. It's about listening to your body and giving it what it needs, whether that's rest, nourishment, or a good laugh with friends. All these strategies are not one-size-fits-all solutions. What works best for one person might not work for another, and that's perfectly okay. The key is to explore different approaches, be patient with yourself, and remember that progress is not always linear. Anxiety disorders can be a formidable opponent, but remember, you are not alone in this fight. There are countless resources and supportive communities out there, ready to help you reclaim control over your life. With the right help and strategies, it's entirely possible to manage anxiety disorders effectively. Mental wellness isn't just about avoiding disorders, it's about living a full, healthy life. Mental wellness is the state of well-being in which an individual realizes their own abilities, can cope with the normal stresses of life, and can work productively while contributing to their community. It's a vital part of our overall health that often gets overlooked in the hustle and bustle of our daily lives. But why is it so important? Well, mental wellness is the cornerstone of emotional balance and personal growth. It allows us to enjoy life and helps us to form a rich tapestry of relationships, hobbies, and experiences. It's the force that drives us to adapt, to change, and to cope with adversity. Moreover, mental wellness plays a crucial role in preventing anxiety disorders. Anxiety disorders often stem from an inability to cope with stress, fear, and worry. But when we prioritize our mental wellness, we equip ourselves with the tools to manage these feelings effectively. We learn to understand our emotions, to recognize when they're becoming overwhelming, and to take steps to address them. For instance, stress management, a key aspect of mental wellness, can keep our anxiety levels in check. It's about finding balance in our lives and taking time out to relax and recharge. This doesn't necessarily mean we'll never experience stress or anxiety, but it does mean we'll be better equipped to handle them when they arise. Similarly, a focus on mental wellness can also help us to avoid panic attacks. Regular exercise, adequate sleep, and a healthy diet can go a long way in maintaining our mental health and preventing anxiety disorders. In essence, mental wellness is about building resilience, nurturing a positive outlook, and developing coping strategies that work for us as individuals. It's about understanding ourselves and taking care of our mental health in the same way that we would our physical health. Remember, mental wellness is not just an absence of mental disorders. It's about feeling good about yourself, about others, and about life in general. Mental wellness is not a destination but a lifelong journey. We've covered a lot today, and we hope this information has been helpful to you. The journey of understanding anxiety disorders, their causes, symptoms, and coping strategies is a continuous one, and we're here to walk with you every step of the way. If you found this video valuable, don't forget to hit that like button. It's a small action that can have a big impact, helping us share this important message with more people. And if you haven't already, please consider subscribing to our channel. We're constantly exploring mental health topics, stress management techniques, and ways to promote mental wellness. By subscribing, you'll be part of a community that's committed to learning, growing, and supporting each other. Feel free to share this video with anyone who might find it useful. Remember, seeking help is a sign of strength, not weakness. And most importantly, remember, you're not alone in this. Reach out, seek help, and take the first step towards your own mental wellness today.